All right, welcome back to ABA exam review and our RBT exam practice question series. Today we're continuing with our next set of questions. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Make sure you let us know when you pass so we can include you in our Sunday shout out. Check out btexamreview.com for all of our study materials, including our combo pack. As always, work hard, study hard. Let's get going. Lane, a behavior technician, meets up with some friends who are also technicians but work at a different company. Lane has a particularly challenging case, so he asks his friends what they think about using extinction for escape-maintain behavior. Has Lane violated an ethical code? So, an ethics question, we don't want to panic on ethics questions. They're usually pretty black and white, and you want to pick the answer that's not too weak and not too strong. It's kind of a common sense answer. So here we have Lane, who's meeting up with friends. They're also technicians, and he's got a challenging case. So we all know we sometimes have challenging cases. We have questions about ABA, and the ethics code comes into play as far as what you are and aren't allowed to discuss. You're allowed to discuss ABA, of course. You're allowed to discuss interventions. You just can't talk about your clients, any personal details, any details about their family. So you've got to speak in terms that are not relevant at all to the client, basically. Nothing that would reveal who that client is. You have to avoid that by all measures, right? Because of HIPAA, because of the ethical code, for a million different reasons. So Lane just has to be very careful when discussing extinction for escape maintain behavior, but he's not necessarily banned from discussing this, right? So according to the ethical code, has Lane done anything wrong? A, yes, Lane should not discuss his clients with those not on the team. Well, he's not necessarily discussing the client, right? He's just discussing extinction for escape maintain behavior, which is just an intervention. It's what me and you are discussing right now. B, no, as long as Lane did not reveal personal information about the client. Yes, as long as he's not revealing anything personal, as long as he's not revealing anything identifiable about this client, he's certainly free to discuss extinction and how it affects escape maintain behavior. C, yes, Lane should not question his client's treatment plan. Of course not. As an RBT, you are part of the team. You have a voice. You should have a voice. You should raise questions when you have questions. D, no, Lane is free to discuss clients as he wants. Oh, he's not. He can't talk about them, their personal personalities, their personal needs. Anything that's revealing, he's got to hide. But he can simply discuss extinction as it relates to escape maintain behavior. There's nothing wrong with that. So, has Lane violated an ethical code? B, no, as long as Lane did not reveal personal information about the client. A mom steams some vegetables for her toddler. Each time the mom gives her toddler a piece of vegetable, she praises the toddler as well. The mom is attempting to do what with praise? Think about this for a second. We're asking about the praise, right? So we know we have vegetables, and we know the mom gives her toddler a piece of vegetable and praises the toddler as well. So what do you think she's trying to accomplish by delivering praise with the vegetables? Well, clearly some sort of pairing procedure. So A, create an unconditioned reinforcer. If you're pairing something, the thing that is paired cannot be unconditioned. It's clearly conditioned, it's clearly learned. Food is unconditioned. Praise is not. B, create a primary reinforcer. A primary reinforcer is the same thing as an unconditioned reinforcer. Primary reinforcers are unlearned. They're unconditioned. Secondary reinforcers are conditioned. So what she's trying to do is pair this praise with what we can assume is a primary reinforcer. Now, it doesn't say it is, but given our answer choices, it's our best answer. Food is a primary reinforcer. In this case, she's clearly trying to pair the praise with the food. So she's trying to pair the praise with the primary reinforcer. Of course, D is wrong because it isn't unconditioned or it isn't primary. It's going to be a secondary conditioned reinforcer. Jebediah screams and screams and screams until he cannot scream anymore. Occasionally, he will not scream for 2 or 3 seconds, at which point his mom will give him chocolate. The mom is attempting what? Interesting. All right. Interesting procedure here. We know Jebediah screams and screams and screams and screams some more, right? However, sometimes there'll be a good 2 or 3 seconds where he doesn't scream. At what point his mom will give him chocolate? So when is his mom giving him chocolate? Is his mom giving him chocolate for a replacement behavior or in the absence of a behavior? Well, she's giving him chocolate in the absence. There's no replacement going on. It's only when he's not screaming is he getting this chocolate. So what do we consider that? A, differential reinforcement of other behaviors. Yes, DRO, differential reinforcement of other behaviors, involves reinforcing in the absence of a behavior when a behavior is not occurring. And Jebediah is only receiving reinforcement when the behavior isn't occurring. There is no replacement behavior being taught. So B and C, alternative and incompatible behaviors, those teach replacement behaviors. So if we're not teaching a replacement behavior, it can't be B or C. It can't be alternative. It can't be incompatible because we're not teaching anything to replace it. We're simply reinforcing for the absence of the screaming. So the behavior isn't occurring. We're using a DRO procedure. So the mom is attempting a differential reinforcement of other behaviors. What distinguishes automatic negative reinforcement from socially mediated negative reinforcement? So we have negative reinforcement, negative reinforcement. Negative reinforcement, where we're removing a stimulus that is increasing behavior in the future. But we need to distinguish between automatic and socially mediated. And we know automatic is actually a function, right? And automatic essentially means alone or solo. You don't need another person, right? Socially mediated involves another person. So automatic negative reinforcement is only going to involve the learner. Socially mediated negative reinforcement is going to involve the learner, somebody else. So A, socially mediated increases behavior while automatic decreases. No, automatic and socially mediated don't affect it. Reinforcement and punishment, the consequences affect behavior. B, socially mediated does not require another person. Incorrect, socially mediated does require another person. C, automatic does not require another person. Yes, automatic behavior does not require another person by definition, right? Socially mediated does. D, there is no difference between these two procedures. Incorrect, automatic does not require another person. So what distinguishes it? Well, C. A man visits a psychiatrist to evaluate his mood. The psychiatrist begins by presenting him with 2 ink blots and asking the man to pick which one he likes better. This most resembles a what? Interesting. Very applied question here, right? We know this man visits a psychiatrist. The psychiatrist presents him 2 ink blots and asks the man to pick the one he likes better. Now, the giveaway is just 2 ink blots. If I'm presenting 2 stimuli at once and asking you to pick the one you like better, what am I doing? A, differential reinforcement of incompatible behaviors procedure. Well, no, he's not differentially reinforcing in the absence of a behavior. We just went over this. B, a paired choice assessment. Yes, paired choice or forced choice, right? We've got 2 stimuli, and we're asking you to pick which one you like better. C, a single choice assessment. A single choice assessment occurs when there's a single stimulus being presented. And then D, differential reinforcement of alternative behaviors procedure. Again, he's not differentially reinforcing anything, okay? He's simply offering an assessment. Which one do you like better? Do you like A or B? Ink blot A, ink blot B. It's a paired choice or a forced choice assessment. You are observing a client one day in the 3rd grade classroom. The teacher walks up to you and tells you that he would like to learn better ways of responding to behaviors from your client. The teacher wants to learn what? All right, we're looking at the teacher's behavior. And we know the teacher tells you he wants to learn better ways of responding to behaviors. So we know there's 2 ways to approach it, right? We can be proactive and anticipate and prevent behavior, or we can respond and react, right? And when you respond and react, it's after the behavior occurs. It's a consequence, right? He wants better ways to do or to implement consequence interventions. A, an antecedent intervention occurs prior. It's proactive, it's preventative. B, a consequence intervention is reactive. It's a response. C, functional communication training. Possibly, right? But functional communication training is really an antecedent intervention. He's asking for consequence interventions. Same thing with D, non-contingent reinforcement is an antecedent intervention. He wants to know better consequence interventions because he wants to respond or react better. So the teacher wants to learn what? B, consequence interventions. Bobby spends 5 hours in the kitchen preparing a romantic meal for his wife for their anniversary. After her first bite, his wife says she likes the lemon flavor of the chicken. Bobby never spends 5 hours cooking again. The wife's response is what? Now, be careful here. We have to look at the behavior. It's a reinforcement punishment question. What is the behavior we're looking at? We're looking at Bobby spending 5 hours in the kitchen preparing the meal. The wife then says she likes the lemon flavor of the chicken. So how does that affect Bobby's behavior? Well, he never spends 5 hours cooking again. His behavior decreases. So was the wife's response reinforcing or punishing? Well, it was punishing. So we know it's a punishment because the behavior decreased. It doesn't matter what it looks like. It only matters about future behavior. And in the future, Bobby doesn't spend 5 hours cooking anymore. Then you ask yourself, was it positive or negative? Well, was something added or taken away? Well, clearly, she says she likes the lemon flavor of the chicken. The response was added. It's positive. Behavior decreased, punishment. Response was added, positive. Therefore, the wife's response is C, positive punishment. If you worked 70 hours last month as a behavior technician, how many hours of supervision would you need minimum? Now, supervision question, and you need to know as an RBT, what percentage of hours do you need supervised? And the answer, of course, is 5% per month. So what you're going to do is you're going to take the total amount of hours you worked, which is 70, divide it by 0.05, 5%, and that's going to give you your answer. And the amount of supervision you need minimum is 3.5 hours. You can get more, certainly, no big deal, but the minimum is going to be 3.5 hours. Excellent. Thank you for watching. Make sure you check out btexamreview.com for all of our study materials. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.